name is Sherman Lohnes. I'm the Director of the Division of Healthcare Facility Licensure and Certification with the Bureau of Healthcare Safety and Quality of the Massachusetts Department of Public Health. With me today is Sheila Lee from the Department of Mental Health. On behalf of Commissioner Monica Burrell and Interim Bureau Director Eric Sheehan, I want to thank you for taking time this morning to participate in this hearing. The Department is holding this hearing on the proposed closure of the Rogers Inpatient Psychiatric Unit at St. Luke's Hospital, effective no later than October 31st, 2015. We are holding this hearing to provide the community with an opportunity to comment on the proposed closure. The hearing is a public forum for the presentation of any comments that may be relevant to the Department's consideration of this matter. Following this hearing, the Department will make a determination as to whether the services to be discontinued are necessary for preserving access and health status to the hospital service area. The Department will consider evidence presented at this hearing, the current utilization of these services, the capacity of alternate sites to provide the service, and other relevant information available to the Department. The Department will make its determination within 15 days of today's hearing. If the Department finds the services to be discontinued and necessary for preserving access and health status, the Department will require the hospital to submit a plan for assuring access to the service within 15 calendar days of its finding. The plan which the hospital submits will be reviewed by the Department. We'll begin this hearing with a brief presentation from the hospitals, from the community to comment on these proposals, and then begin calling on individuals who requested to speak. I'll be calling speakers by name from the sign-in sheet that we've collected. If you've not already signed in and would like to speak, there'll be an opportunity to do so when we've gone through the names on the list.
Good morning, everyone, and welcome. My name is Renee Clark. I'm the Senior Vice President and Chief Operating Officer for Southcoast Hospitals Group. I'd like to thank Sherman for giving us this opportunity today to discuss our work to expand behavioral health care in our region. The critical shortage of behavioral health and substance abuse treatment and services, particularly inpatient care, is the most pressing healthcare problem in the communities we serve. Indeed, it is a problem that afflicts the entire state. Today, many of us know a family member, loved one, neighbor, or friend who struggles to stay off of drugs, particularly opioids, or cope with depression or battle psychosis. Their options for help are few. Southcoast operates the region's only general psych inpatient care unit, the Rogers unit, here at St. Luke's Hospital. The unit's 30 beds are always more than 97% full, placing a significant strain on our emergency departments, St. Luke's here in New Bedford, Charlton Memorial in Fall River, and Toby in Wareham. Where on any given day we can routinely have more than 20 to 30 behavioral health patients boarding in our EDs. These patients often board and can wait up to 4 or even 5 days for admission to an inpatient facility. To help alleviate this strain in our emergency departments and to better serve the behavioral health needs of our communities, Southcoast Health has entered into a joint venture with Acadia Healthcare, a leading provider of behavioral health services in this country. The result of this partnership is the new Southcoast Behavioral Health Hospital, which is being completed, or is now complete, I should say, just 5.67 miles away from us here on Faunce Corner Road in Dartmouth. It will start taking patients next week and provide a full spectrum of comprehensive, high-quality inpatient care. Southcoast Behavioral Health will provide 120 beds in a state-of-the-art hospital, including the 30 beds transitioning from the Rogers unit. This will represent a net gain of 90 beds and a doubling of the number of inpatient beds currently available in our region. Under the joint venture, During Health Services will serve as the CEO of the hospital. Dr. Doug Muncie, who currently leads the Rogers unit, will also transition to the new hospital as of Monday. Acadia's healthcare commitment to community-based care mirrors Southcoast Health. Just like the Rogers unit, the new hospital will accept all forms of insurance and no patients will be denied care. By gathering inpatient services for adolescents, adults, and older adults under a single roof, Southcoast Health will be better suited to concentrate on enhancing outpatient behavioral health services in our region and in partnership with our community providers. Our experience with the Rogers unit tells us that soon after discharge, patients often experience a new crisis that sends them right back to our emergency department. That's because of a shortage of outpatient services and other options for care that leaves them without ongoing support. The behavioral health organizations in our communities work valiantly to meet the needs, but without a more robust infrastructure of care in the region, they too are overwhelmed. Last month, Southcoast Health launched Behavioral Health Connect, an online directory of behavioral health services and other resources in the region. We created this public directory with the support of the State and Health Policy Commission's Community Hospital Acceleration, Revitalization, and Transformation Investments Program, otherwise known as CHART. Now, with the second CHART grant, we will be working with community partners to coordinate outpatient care, developing best practices and protocols, and establishing evidence-based medication therapies. At Southcoast Health, we know that a healthy mind is as important as a sound body. Our partnership with Acadia Healthcare is another sign of our commitment to our patients and our communities as we deliver care for the whole person, not just his or her medical symptoms, fulfilling our mission of helping all patients in our communities achieve and sustain optimal health. Thank you.
Good morning. Usually I'm relatively new to the State House, so usually I speak last, so a little surprised by being second. To me, this is a no-brainer. The idea of expanding more of our behavioral health system in this region. You guys know when you deal with Department of Mental Health, from your own experiences, you hear the same complaints, particularly in the gateway cities. Emergency rooms are full with people who have acute mental health issues. They sit, they wait, they become an incredible burden on the people who are trying to get the physical medical conditions prepared in the emergency room. But it becomes a very difficult situation. And I come to you kind of with several different hats. One being a state representative, one being a father who has spent too much time in the emergency room, one being a lawyer in town who has firsthand knowledge of this, and one as a former prosecutor. Every statistic, everything that we know about criminal behavior, we talk about it all the time at the State House. Substance abuse in 87% of all people in state prison. Most of them have dual diagnosis with serious mental health issues. Okay, well, what do we say about that? What do we try to do in the system? Well, the criminal justice system probably isn't the best place for that. And we all kind of come to that agreement. But because it is something that personally I'm not trained in as a prosecutor nor as a defense attorney, we spend most of our time on a very practical level trying to find a bed for somebody. Doctors who are forensic psychologists in our local courthouses spend the majority of the time not interviewing, trying to obtain as much information as they can, which they do a very good job of, but they spend most of their time trying to find a bed for somebody, trying to find a place where they can go, or spending their time trying to explain to the mother who's so desperate that she comes in for a Section 35 and asks the court at that in public, my daughter, my son has a huge drug addiction issue and he needs help. And to be able to do that in open court, to expose those private, very emotional issues to the court, you know they're that desperate. Yet we don't have the places to bring them. So in the court system, I've seen that having more beds available is crucial to making sure that, one, we don't have people coming back committing crimes who are suffering from mental illness or drug addiction. We hope we can have a real system in place where we can take one individual, take him right to a location where they can get help. And I think that's what Acadia is going to do on Faunce Corner Road, that opportunity to do that. And quite frankly, we hear all the time, well, Rogers doesn't have a bed available, Rogers doesn't have a bed available. So it becomes an incredible burden on what to do. That's one side of one hat that I wear. As a defense attorney, I get to hear the intimate details of what these people have gone through. And they need help from the get-go. This isn't one or two things that occur in the last month. This is a lifelong issue for so many people. And they can't deal with it just by having the court tell them, well, we'd love to help you. It would be nice. And you know exactly what they've gone through. And you hear that and you just say, damn it, the bureaucracy just gets in the way. There's nothing available. We need to do something. So as a defense attorney, I look at it and I know that these people can get help. They want to get help, but they just haven't had the chance. And as a father, when you're sitting in the emergency room with a 10-year-old daughter who twists her ankle or gets a concussion playing soccer, and she's sitting there, and the next bed over is a guy cursing, swearing at every other individual in the place, tied up maybe, who knows, but clearly upset. I will tell you, we had the experience of my son getting a bad concussion, a soccer game in Lancaster. We went to hospital in Clinton. You talk about emergency rooms, it's like walking into the Four Seasons there. There's no one there, right? You come here, it's totally different, except one individual. And they have two people standing at the front door of her bed. She's yelling and screaming, cursing at him because she wants to go. Come to find out, she's a regular who goes there, has these issues. But that's how we treat these people. And I think we need to have the opportunity to have more beds, have Acadia be available, and be able to say to people, we have a place for you. So as a state representative, I would just say, this is what the community desperately needs. And I think Southcoast has stepped up. They've taken the opportunity to match up and meet up with Acadia to make sure that this is a great opportunity for our community. And I would just say that, to me, the license issues that deal with the 30 beds here are simple. We're going to increase the capacity to deal with an issue that has greatly affected our community, has greatly cost our community, and can only help our community. So I hope that whatever we can do to assist you in making that decision, I'll be available, and I know the other members of the delegation will be available. So thank you very much for your time.
Good morning. Thank you very much, Sherman and Sheila, for hosting the event, and Renee for the invitation. My name is Kevin Burchell. I'm the Chief Executive Officer for Arbor Fuller Hospital in South Attleboro. Arbor Fuller Hospital is a 103-bed private psychiatric hospital that offers adolescent, developmental disability, and adult services, as well as addiction treatment services, and has been doing so for the past 80 years. We're part of the Arbor Health System, which represents 5 hospitals, 2 satellites, and 13 counseling centers, over 500 beds across the Commonwealth of Massachusetts. And we're sponsored and owned by Universal Health Services out of King of Prussia, Pennsylvania. I heard your remarks here this morning, Renee, and I'm very impressed with your program for adolescent, adult, and older adult services. I'm here to speak on behalf of our developmental disability unit. We have 12 beds. We have the only 12 beds that are licensed in the Commonwealth of Massachusetts. Our DDU has been in existence since June 1st, 1989, with a cooperative arrangement with the Department of Developmental Disability Services, Region 5 down here in southeastern Massachusetts. With our most recent renegotiation of our contract, we offer DDS Region 5 additional capacity. They have 4 of our 12 beds. We asked them if they would like another 2 to 4 as we expand our unit from 12 to 18. They declined. So I'm fully understanding of your adolescent, your adult, and your older adult programs. I'm here to speak on behalf of our DDU, which is the only DDU with plans to expand. Thank you very much.
Good morning. It's with great pleasure and confidence that I write in complete support of the new Southcoast Behavioral Health Program and the opening of a 120-bed facility in Dartmouth. The transition of the 30-bed inpatient unit beds from St. Luke's Rogers unit to the new facility appeared to be a natural course of action, and certainly based in efficiencies for the betterment of those needing inpatient psychiatric and dual diagnosis treatment. I'm particularly pleased to support the addition of adolescent treatment as part of the new facility. As a child welfare practitioner for the past 28 years and the Director of Children's Services in the Southcoast region in various roles for the past 17 years, I have heard too often the challenges parents face when their children cannot access needed inpatient psychiatric services due to bed availability. This has resulted in children being housed in emergency departments for days and sometimes weeks awaiting placement in a treatment facility. The capacity to address adolescent services to include dual diagnosis will be a welcome addition to the gaping deficit that has existed for many years. Further, when children from southeastern Mass are deemed in need of hospital level of care, they will be able to access evidence-based treatment in their community of origin. Too often is the case of a child waiting placement in the ED for days and then being placed in the greater Boston area, North Shore, or other not easily accessible locations for family members. Southcoast Health Systems has and continues to be a leader in developing a span of services to meet the needs of the community in which they reside. This facility is such a welcome and concrete solution to a problem that has existed for the past many, many years. As a former state social worker, a program contract manager, and then a director at a residential treatment facility, I was frequently part of a regional meeting called the Stuck Kid List. This meeting structure, which included MBHP and other insurers, became a necessity and a monthly reality as the result of children waiting for inpatient psychiatric placements in emergency departments across the region and the state, as well as the team assembled for review of needed step-down placements for children into lesser levels of care. Can you imagine a meeting structure called the Stuck Kid List? The opening of the Southcoast Behavioral Health Facility will get the region one step closer to addressing the long-standing capacity issues for adolescent inpatient mental health services. As the director of the Children's Advocacy Center of Bristol County, we have been part of instituting the agency's mental health capacity building program since 2010. This was to address the region's very poor results of an informal assessment regarding the number of credentialed clinicians trained in trauma, complex trauma, and the treatment of chronic toxic stress, which are known precursors and factors contributing to suicidal and other self-harmful and risk-taking behaviors. The need for children and families to access well-trained mental health providers has been the impetus for the agency having provided, with us serving in the capacity of a regional coordinating funding agency engaging experts. We've provided specific evidence-based trauma-informed treatment to more than 200 clinicians from more than 20 different agencies spanning Brockton to New Bedford. Southcoast Behavioral Health will be a welcome addition to increase the expertise in this area. It will allow for cross-agency training and collaborations for community-based providers can access, and it will foster opportunities to further develop partnerships for treatment services along the continuum and the ever so needed increased need for psychiatric services in this area. In short, the need for increased inpatient psychiatric care and the capacity has been long-standing. The transition of the Rogers unit to a state-of-the-art facility with the addition of 90 beds consisting of 5 different units with treatment specialization will only serve to enhance the area services and promote overall health and well-being to those in southeastern Mass. Thank you very much.
I appreciate the opportunity to come here and to offer our testimony from partners for a healthier community. The opening of the new 120-bed inpatient behavioral health hospital on Faunce Corner Road in Dartmouth, built by Acadia Healthcare, is a welcome sign that mental and behavioral health services are beginning to improve in the South Coast. For too many years, the population has been underfunded and underserved by both the public and private systems of care, and the opening of this new state-of-the-art facility signals a change for the better for both patients and family members throughout the region. The opening of this new facility also promises to serve as a magnet to increase the numbers of fully qualified professional staff needed to adequately serve our population, something that has been a constant challenge for local provider organizations. As a psychologist for the Department of Mental Health for over 30 years at the John C. Corrigan Mental Health Center in Fall River, I have been acutely aware of the chronic shortage of both acute and chronic care beds for this population. The limited 16-bed unit at the Corrigan Center and the equally stressed 30-bed Rogers unit at St. Luke's Hospital have never been adequate to meet the care needs of mental health patients. Equally, the limited beds at Stanley Street Treatment and Resources in Fall River and at the High Point Women's Addiction Treatment Center in New Bedford have never also been adequate to meet their needs, and patients from the area are frequently sent many miles away for treatment, adding to the stress levels of family members. It is the mission of Partners for a Healthier Community, the organization for which I now work, to improve the health status of the residents of Fall River, Somerset, Swansea, and Westport. And a substantial portion of the residents of each of these communities finds themselves in need of mental health and substance abuse treatment each year. The resources to meet those needs should be greater than what is found throughout the Commonwealth. In reality, the resources of this area are far below what is needed or what is found frequently in the Boston area and other parts of the Commonwealth. This transfer of beds from the Rogers unit at St. Luke's Hospital and the opening of the Southcoast Acadia facility should substantially improve the availability of hospital services, thus reducing the need to transport patients long distances for treatment. While the addition of this facility will help many patients, there is more that must be done. We are all well aware that inpatient care is a time-limited and expensive specialized service. Adequate mental health and substance abuse treatment has to also include both partial hospital and a full array of outpatient and supportive services. Unless the range of those services is also increased, the anticipated increase in hospital beds will not address the current and future needs of this area. Governor Baker has recently committed new resources for the provision of both mental health and substance abuse treatment in our area, and it is our hope that these additional services, when combined with increased hospital beds, will finally begin to address the long-standing shortage of treatment resources for the greater Fall River as well as Southeast region. Thank you very much.
Good morning. I'm Bill Parsons, the CEO of Southcoast Behavioral Health, and it is my honor to work with Dr. Douglas Muncie, the Medical Director of Southcoast Behavioral Health, and the rest of the Southcoast Health team to bring a beautiful new state-of-the-art hospital to the Southcoast region. As you might have figured out from my accent, I came to this region from Tennessee. And so just last winter I had served as the Chief Administrator since 2009 of the Vanderbilt Psychiatric Hospital and was also the Associate Executive Director of the Vanderbilt Behavioral Health. I have a degree in psychology, a master's in counseling, and a PhD in counseling from the University of Florida. I've devoted my entire career to behavioral health, and it brings me great pleasure to help meet the critical need of this region for inpatient care. The need is so dire that we anticipate serving almost 3,400 admissions in our first full year and just over 4,000 in our third year. With all the services the hospital will offer, there's the potential to evaluate more than 5,000 cases a year. The 77,000 square foot hospital will provide a robust psychiatric program for adolescents, adults and older adults, as well as treatment for mental illness that is accompanied by substance abuse. We will benefit from Southcoast Health's clinical expertise and profound understanding of the population that it serves, as well as Acadia's specialization and in behavioral health and the fact that we operate 5,800 inpatient beds across the country, including Puerto Rico and United Kingdom. The depth of experience that we have in the field of behavioral health and substance abuse treatment is unsurpassed. The hospital was built with the best interests of patients in mind. It will offer a soothing interior, as well as a gym and outdoor areas and activities. Every day, patients can gaze at amazingly beautiful scenery and paintings that are on the wall in the hospital, such as the Mattapoisett seahorse, which happens to be one of my favorites. And remember that the paintings that they're close to remind them of the place that they love. And perhaps they might even know some of the local artists who painted them. As patients prepare for discharge, step-down care will allow for successful transition to the community. And I'm committed to opening the facility to the community through lectures and educational programs to lessen the stigma of mental illness and to help ensure that over time our community and our patients re-enter, that the patients re-enter is more welcoming and understanding of mental illness. The region has been fortunate to have Rogers Unit available at St. Luke's, but this new hospital that we've built will better serve the community's needs. By moving the unit's 30 beds to the new facility, we will ensure that all Southcoast behavioral health patients have access to the same high level of inpatient care. It is also much more efficient and effective to care for all of our patients under a single roof. And just as the Rogers Unit, we will care for everyone. No one will be turned away from our doors. In fact, I want no patient to fall through the cracks, so I'm working hard to build relationships with other behavioral providers in the community. And we want to be partners in care both on an inpatient, when an inpatient referral is needed, and as we help patients plan to resume their life in the community. Southcoast Behavioral Health will open in a measured fashion, starting with a few patients next week. Currently we have 85 staff members. We will grow to nearly 200 as we open all 120 beds. Our recruitment has been mainly local. Most of the staff of the Rogers Unit have opted to join us at the new hospital, and I've been extremely impressed with the talent of the social workers, nurses, and clinicians that are available in this area. It is because of them and because of Southcoast and Acadia's decision to deliver high quality of care that I'm confident that we will quickly build a reputation for excellence and compassionate commitment to our communities. Thank you.
My name is Jennifer Pope, and I'm the physician chair of the emergency department at St. Luke's. Thank you for allowing me this morning to come and speak about what I see every day in the emergency department as a result of the acute shortage of behavioral health inpatients in our region, inpatient beds in our regions. We are proud to serve as a safe haven for individuals from the greater New Bedford area who suffer acute psychiatric health problems. But once we stabilize these patients, they often require more care than we are able to deliver in the emergency department. They need specialized care of a behavioral health hospital, and very often we have nowhere to send them. The 30 beds of the Rogers Unit are more than 97% occupied at any given time, and there are fewer local options for inpatient treatment. So patients must board with us until a bed opens up, and sometimes in a facility, they are sent far from home. At any time, at least 25% of our emergency department clinical care spaces are occupied by behavioral health patients waiting for placement. Their wait can last 24 to 36 hours or extend as long as 4 to 5 days, depending on the type of care they need. As an example, today we have someone starting his 8th day in our emergency department. As an example, one 78-year-old woman who was suffering from progressive dementia waited for days in our locked, secure room while we've tried to find a geriatric bed for her. All she wanted was someone to talk to and scrambled eggs. Everyone on our staff did their best to stop and talk with her and take time to connect with her. And when our cafeteria actually had no scrambled eggs, one of the interpreters went out and bought them for her with her own money. That is the strength of our commitment to deliver the best and most compassionate care to every patient. But once a patient is stabilized, he or she is not well served in the emergency department. These patients need ongoing daily psychiatric assessment and treatment that we cannot offer. We do our best to provide a safe transitional environment for these patients, but the stimulation of an ED can worsen their mental health symptoms. We have a busy, fast-paced emergency department. Our lights are physically always on, which means it's not the best environment for patients who struggle with mental health. Boarding psychiatric patients also makes it more challenging for us to treat patients with broken bones, chest pain, high fever, and many other medical problems that send patients to us for their emergency care. When up to 1/3 of our beds are occupied by patients waiting for psychiatric placement, other patients are forced to wait longer. We believe this partnership with Acadia will allow us to arrange appropriate care for behavioral health patients faster and more effectively than we can today. We anticipate a wonderful connection that will result in better delivery of care for all patients who depend on our emergency department at St. Luke's.
Thank you. For the record, my name is Pat Haddad. I represent the 5th Bristol District, which is the west end of the South Coast catchment area, and currently I serve as the Speaker Pro Tem of the House. I know you've heard from my colleague whose district the hospital will reside in, and I know you've heard from a lot of providers already this morning, and I'm very happy that you've heard from members of the South Coast family itself. I'm here because several years ago it came to my attention that all of the things that these people have talked about, the inability to find beds, the long waits in the ERs, the stretch of services for the people that I serve and the people of the South Coast were becoming more and more of a problem for us. To that end, I engaged in a process with South Coast to bring together people to talk about what would be the best results for us down here. What would be the best steps to take? And I'm here because South Coast took it upon themselves, didn't wait for the state, didn't wait for other people to take part in this, trying to fix this problem. They took it upon themselves to make sure that this region and their catchment area was served in a way that was not only better, but state-of-the-art, and is a process that I am here to not only urge you to allow them to continue, but to congratulate them. The problem that's been talked about here about being boarded in ERs, you know, is not something that we just see down here on the South Coast, but we do see it here more as an issue because of the demographic of the community that we serve. We serve some very, very poor people. We serve people who do not have English as their first language. And we serve people whose educational attainment level, unfortunately, is not necessarily up to par with the rest of the state. So the services that will be offered through Acadia and have begun to be offered early on in the process by South Coast is going to not only address the health needs and the mental health and behavioral health needs of this community, but also the spirit of the community, so that they know that even though they very often see themselves as that lower educated, unable to speak English well, and poverty-stricken community, that an entity has decided that they care more about them than they care about their abilities to make a profit. Because we know, you know very well, that the reimbursement rates, and I know that's probably not something people want to get into today, but the reimbursement rates do not encourage people to give the services that are so necessary for behavioral health. So for a hospital, and a large hospital like the South Coast is, to take this on is not only amazing, but it's a risk. It's a risk for them, but they have decided that it's a risk so well worth taking to serve the community that they have served for so many years, that they've partnered with a terrific group who has the reputation to provide services not only locally, but across the country. So I'm here to urge you today to allow this license expansion or license to go forward in order to really help not only the adults, but the adolescents of this community, because nobody's even, I did hear Michelle talk about adolescents, but these are problems that they're overwhelming at times. And so on behalf of the rest of the delegation of the South Coast, I would like to urge you to allow this license to go forward. And thank you for taking me out of turn.
Good morning. I'm Dr. Lisa Llamas, and I act as the Psychiatry Emergency Department Liaison here at St. Luke's. As such, I see firsthand the great volume, the challenges that the great volume of behavioral health patients presents to our ED. Our ED providers assess an average of 36 new behavioral health patients every day. The behavioral health census in our emergency room often exceeds 20 patients. Today, I think we have about 23, 24. One of the most substantial challenges we face in the emergency department with regards to the behavioral health population is finding inpatient psychiatry beds, both for our behavioral health patients and also for our dual diagnosis patients. This lack of appropriate beds is responsible for long boarding times, and in turn causes a real strain on the emergency department as a system. It places a strain on emergency department providers, only a few of whom are psychiatric providers or clinicians. It also places a demand, it also impacts the community, and the emergency department is here to serve the emergency medical needs of the community and the behavioral health needs of the community. The behavioral health patients comprise only 8% of our emergency department volume, and yet the direct care hours required to appropriately treat these patients is 30%. This is due in large part to the long boarding times. Having worked at the psychiatry department at St. Luke's Hospital for the last 4 years, I see very few disadvantages to closing our 30-bed Rogers unit when it is in coordination with the opening of a 120-bed unit with its ample outdoor spaces, the plan to have specialized treatment units, and is in coordination with Southcoast. This will impact the emergency department as a system, giving relief to the system, to the ED providers, also to the community who seeks medical care in our ED. But most importantly, it will give relief to the behavioral health patients who will spend much less time boarding an ED and have much more rapid access to treatment. Thank you.
Good morning, and thank you for the opportunity. My name is Carl Alves, and I am the Director of Positive Action Against Chemical Addiction, which is a consumer-driven organization that provides recovery support services in the area. And I'm pleased to lend my support, my full support, to the transformative plan that is being introduced. Quite frankly, 120 beds is a significant increase in our area. It'll widen the open door of our continuum of care, and it's very, very much needed, because the Southcoast, as Dr. Weed has mentioned, has been underserved for so long. And I'm very, very excited about the possibility. On an annual basis, through my little grassroots organization, we're seeing 500 plus people a year seeking various levels of treatment, coming in and out of the hospital. And so we've been able to develop new and good partnerships going forward. I applaud Ms. Clark and Mr. Parsons' staff and team who are working on this, because it is a large endeavor and there's a lot of unknowns, obviously. But I am confident that between what Acadia is able to do, the new facility with High Point, I think this region is set to create a pathway for more talent, because recruitment Getting experienced talent is a major need in this area, and I think the confluence of all of these things happening sets us well going forward, so I'm very excited about that, and I fully support the effort. That said, I also want to have a bit of a caveat. As a community-based person, I recognize that when we open the front end of a continuum, there is going to be a larger flow through that continuum, and some of that continuum is going to impact locally on local endeavors. And I'm not saying this as if it's somebody else's responsibility, but I want to point out and point out to DPH that we need to have a shared responsibility and build capacity throughout the entire continuum with the services that are necessary to maintain people when they're not in direct care, namely recovery support services. One of the, we don't have a recovery support services contract in Southcoast from DPH, and that would greatly support it because we know that self-help and recovery support services are a great way to reduce recidivism. So let me just close by saying thank you all for your hard work doing this, and I am very excited. As a resident of Dartmouth, I've been very impressed with the speed and the agility that the building has gone up, and clearly this is an organization that is knows what they're doing, and I'm very excited about the possibilities. Thank you.
Good morning, and thank you for the opportunity to be here. I am Reverend David A. Lima. I am the Executive Minister of the InterChurch Council of Greater New Bedford, a group of 48 ecumenical churches, meaning mainline Protestant churches, but we work across all faith lines and we do extensive work in the community. I'm also the chair of the Greater New Bedford Suicide Prevention Coalition, as well as co-founder of ION, the Interfaith Outreach Network, which works with people afflicted with addictions. Churches in the faith community, quite frankly, many times are the first responders, and we were very inadequately prepared, which is why we came along with a lot of these programs to help train pastors who are sometimes the first people that families reach out to when they have family members in struggles, addictions and suicidal tendencies and depression and all the other behavioral health issues that exist. And quite frankly, the need for this is immense. And I commend the leadership of Southcoast Hospitals, and I definitely commend Acadia for coming to our area, seeing not only the opportunity, but the necessity for this to happen here. I'm a preacher, so let me go back to my notes, which I never use, but I will try, so otherwise I'll be here for a while. We see firsthand every day the human cost of behavioral health crisis here on the South Coast and throughout our nation. We work hard to marshal those resources and collaborate to provide patients the services they desperately need, and this new comprehensive behavioral health facility will be an immense help in these efforts. It's important that the Rogers unit, which operates at almost 100% capacity, be transitioned to the new hospital, which is dedicated to treating behavioral health patients. Its dedicated treatment units, along with amenities that help the healing process, will elevate the level of inpatient care available to this underserved population. The work is vital. It's exacerbated by the lack of trained and qualified personnel, and I believe the new facility will help attract additional skilled caregivers to the South Coast. Again, when you have a smaller place, you have a bottleneck of services, but you have such great need, and sometimes you just can't attract enough people to do the work. There are a lot of good people doing yeoman's work here, but I believe this hospital will actually be able to attract even that much more dedicated people with its necessary skills. South Coast Behavioral Health will treat the full spectrum of behavioral health conditions with a specialized approach, which will allow for greater quality of care. This level of facility and specialization has never been available in one facility here on the South Coast region. Included in its 5 specialty units will be inpatient treatment for adolescents, an extreme need, a service that has been lacking here in our region. I work with our school systems and youth here on the South Coast and know that they struggle to cope with serious behavioral health challenges and significant lack of resources. In fact, I see families who often have to travel hundreds of miles to visit adolescents who must be placed in a distant area of our state or even out of state for treatment. The new facility will also help to alleviate boarding challenges for behavioral health patients in St. Luke's Emergency Department, the busiest community hospital emergency department in the state. we've got to stop stacking and racking and start actually serving. And that has been an immense need and something that we've had to really address. And again, visiting patients in there, seeing the work, that compassion that happens here, knowing that it can be only expanded with the new hospital is an exciting thing for me to see. I work with many patients for whom the emergency department is the only recourse for treatment, and I know that the Southcoast ED see an average of 36 new behavioral health visits every day. This is not the best care for these patients here, but what they're doing will be. Southcoast Behavioral Health combines a state-of-the-art facility with expert care. For too long, patients and providers have struggled. The fragmented system that is inadequate for the demands in our region. This new behavioral health hospital is exactly what our patients and families need and deserve. The collaborative work that happens between both the community, the hospitals, the providers, and everyone else here is, I believe, what helped bring this hospital here. And it is vital, I think, that we not only continue with this, I think it's going to open some great new doors as we continue to struggle with the difficulties that happen here on the South Coast. We work close with the DA's office in suicide prevention. And as I was walking through the front door, I was getting a phone call from the DA's office with an update with our 40th suicide this year here in Bristol County that just occurred yesterday. There is a lot of need, but I believe this is going to go a long way to addressing those needs. Thank you.
That concludes the list of names of people we've had who signed up to speak. Is there anyone else who would like to speak at this time?
I have a letter to submit. I'd like to read for you a letter submitted by Dr. Doug Muncie. Dear Director Lohnes, thank you for allowing me the forum and opportunity to register my profound support for the transition of the Rogers Unit's 30 beds from St. Luke's Hospital to the new Southcoast Behavioral Health Hospital in Dartmouth. As Medical Director of Southcoast Behavioral Health, I currently head the Rogers Unit and am working directly with the Acadia Healthcare team to open the new facility. At the Rogers Unit, the staff takes their work personally, treating those under their care as if they were their own friends and family, and aiming for recovery instead of just improvement. This new hospital will run on these same principles. In fact, the majority of our Rogers Unit staff are moving over to staff the Dartmouth site. It isn't every day that an opportunity arises with so much potential to do so much good for the community. Our partner, Acadia Healthcare, has an impressive track record in the field of mental health both nationally and internationally. Bill Parsons and the Southcoast Behavioral Health team are dedicated, compassionate professionals with extensive experience in the field. The new hospital, with its facilities both indoors and outdoors, is something we have no option to provide on the St. Luke's campus. We will offer an adolescent unit, a geriatric unit, and 3 adult inpatient units, staffed to treat psychotic and affective disorders as well as substance abuse issues. This allows us to construct special treatment programs to address specific needs. Both discharging each patient, we will make a plan in partnership with our outpatient colleagues so that no one falls through the cracks. This new hospital allows us to take a 2-pronged approach to behavioral health, expanding vitally needed inpatient care while strengthening the region's ambulatory network. Southcoast Hospitals Group is focusing on outpatient care through work supported by the Chart investment programs. Mental health is something that none of us can take for granted. Few of us are without a family member or friend who has been touched by behavioral health problems. When a crisis hits, we want to know we have the best care available. It pleases me to know that this new hospital will be a place that people can depend on in a crisis, and that it will be part of a complete network of care that can serve the full range of behavioral health needs for our region. Respectfully submitted by Dr. Doug Muncie.
Is there anyone else who would like to speak at this point? On behalf of the Department of Public Health, I want to thank everyone for the participation in today's hearing. The department appreciates you taking time to share with us your comments and suggestions on this matter. As indicated previously, the department will make a determination as to whether the service is to be discontinued and necessary for preserving access and health status in the hospital service area within 15 calendar days of this hearing and notify the hospital of its determination. If the department finds that the service is to be discontinued and necessary for preserving access and health status, the department will require the hospital to submit a written plan for assuring access to the service within 15 calendar days of the department's notification. The hospital's plan will be reviewed by the department, and the department will respond to the hospital in writing with either approval or written comments. This concludes today's hearing. Thank you for your time today.